You are looking at two people whose lives were cut short by sepsis. It's also known as blood poisoning. Katie McQuestion of Wisconsin and Emily Aiello of Pennsylvania, only 14 years old. In a moment, you're going to hear about the big effort from their families to raise awareness.
Quick stats on sepsis, though. Centers for Disease Control says there are over 1 million cases of sepsis a year in this country, with more than 258,000 deaths every year.
Our chief health editor, Dr. Parthanandi, with us now with details on this disease. Doc, not many people even know what it is.
Yeah, we're talking about it at the break. You know, when people talk about sepsis, they go, what is that? And they just think of, like we talked about, blood transfusion. So what is sepsis? Sepsis is your body's overwhelming response to an infection. So for example, the chemicals that are released to fight an infection, it can basically, your whole body gets damaged, you get organ damage, your entire body shuts down, you can actually die from it. But it's the reaction from a severe infection. And just about anybody can get it, but people who are elderly and the immune system is compromised, like diabetics, HIV patients, they're more susceptible. Anybody can get it, and that's what we want to know.
How do you prevent it?
Prevent it by, number one, recognizing that you have an infection that's severe quickly. So in one of the cases, you know, that we talked about earlier, that antibiotics, you know, took a long time to get. So number one is recognize it and then try to treat them immediately, within an hour if you can, even before an infection is completely diagnosed. So somebody comes in, let's say they have a fever of 101 and above, heart rate over 90, breathing more than 20 a minute, and plus or minus with an infection that's confirmed, you got to treat them immediately. Usually go to the ICU, and that's when you treat them. If you treat them early, you have a better chance of surviving.
So those are some of the symptoms you
Correct.
were naming?
Correct,
Okay.
Exactly.
Okay, how do you treat it?
You know, you treat IV antibiotics and IV fluids, supportive therapy. So sometimes these folks' blood pressure goes down, their kidneys is not functioning, so they go to dialysis. Whatever you can do, you throw the kitchen sink at these folks because they die. They die quickly. So if you have somebody who starts getting sepsis, if the hospital doesn't recognize it, you know, what happens is that within hours they can die. So important, these two families, this is very serious. The families of these two victims are starting a council for people to recognize it. They want hospitals to recognize it more and treat this early, because sometimes people say, well, I'm not quite sure, and that's when you have the problem.
You mentioned it, if hospitals recognize it. What's the issue there? Why are they missing it?
You just have to train people better, you know, because sometimes you're in a community hospital, you don't see many people like this, and then all of a sudden somebody comes in and you miss the science. I think if we go back, and these families are trying to get legislation so people can get trained so they treat them early. Get the antibiotics early and know the signs. Again, the signs, fever over 101, heart rate over 90, respiratory rate over 20. If you get those folks, come in, treat them early, you give them a great fighting chance to survive. Not just do okay, but to survive, because people are dying from this.
Can you find it through a blood test?
Yeah, so
Okay.
you do a blood test to find out if there's an infection, and then the infection you treat it. But before that, you give them broad spectrum. So you treat them with the antibiotics that kill a lot of infections, so you can prevent it from going on to give you all these problems. Blood pressure decreasing, kidney functioning. So really an important topic, and so we're talking about it so people can recognize it and then go to their doctor and in their hospitals and get treated and survive.
All right, thank you,
Wow,
Doctor.
Thank you.
Thanks so much, Dr. Nandi.
My pleasure.
If you have a question or a health concern for the good doctor, you can email him at drnandi@wxyz.com or send it to us on Facebook or Twitter, and we'll get it right to him.